Assalamu alaikum. I'm Dr. Ikra Sheikh, and today my presentation topic is treatment of erectile dysfunction. As we previously discussed the anatomy, physiology, diagnosis, and the laboratory investigations of the erectile dysfunction, today we will discuss the treatment of erectile dysfunction. The content of my presentation include general measures, psychosexual therapy, drug therapy, vacuum devices, and surgical therapy. This is treatment algorithm of the erectile dysfunction. First, assess a detailed etiological framework before any therapeutic suggestion. Identify the patient's need and the patient expectation. Shared decision making and the treatment. Offer the conjoined psychosexual and medical and physical therapy. First, identify and treat the curable causes of erectile dysfunction. Second option is lifestyle.
What are the curative causes of erectile dysfunction? In arterial, we can do revascularization surgery, but there is no success rate. It is very low success rate. So that's why. But in anatomical causes, if there is a curvature, and we'll do the curvature surgery and we will straight the penis, then this may lead to the curative treatment of the erectile dysfunction. Also, if there is a hormonal deficiency, we have to supplement that hormone. Then this is the curative treatment. And if there is a psychiatric problem and we'll correct that psychiatric problem, then this is the curative treatment of ED. Chalo bhai, aage.
Second is the lifestyle changes and the risk factor modification. Third,
lifestyle changes क्या होनी चाहिए? वैसे सबको smoking, alcohol,
regular exercise, healthy diet.
और कौन सी एक्सरसाइजेस करने से कुछ पेल्विक जो है आर्टियल सप्लाई बेहतर हो जाती है? कीगल्स एक्सरसाइजेस. तो हम फिजियोथेरेपिस्ट के पास भेज सकते हैं कीगल एक्सरसाइज. अगर कोई सिटिंग पोस्चर में बैठा हुआ है और वो कंटिन्यूअसली 10 घंटे तक बैठा हुआ है, तो हम उसको कहेंगे कि जो है 10-15 मिनट तक, क्योंकि कंप्रेस करेगा ब्लड सप्लाई को पेरिनियल. अगर इस तरह बैठा रहेगा तो हम कहेंगे कि वॉक, आप 10 मिनट बैठे हैं, फिर उठ के चले जाएं, 5-10 मिनट घूम के आए, फिर वापस बैठ जाएं. तो दीज आर द लाइफ स्टाइल मेडिकेशन. एक्सरसाइज करेंगे, क्विट स्मोकिंग करेंगे, क्विट अल्कोहल करेंगे. ठीक है, चलें.
Provide
एक्सरसाइजेस करेंगे.
Okay.
जी.
Provide education and counseling to the patient and counseling of
और
the
दूसरा जो है वो, if there is a patient is diabetic, then what we will do, we'll control the diabetes. If there is a hyperlipidemia, then we control the lipids. ठीक है, तो ये कुछ चीजें हैं जिसको हम उनको बताएंगे. अगर बाइक राइडिंग से भी फर्क पड़ता है, बाईसाइकिल राइडिंग, तो हम उनको कहेंगे कि कम करें, ज्यादा ना करें, और करें तो स्टॉप एंड स्टार्ट. ठीक है, चलें आगे.
Intracavernosal injection, vacuum devices, oral therapy with phosphodiesterase 5-1 inhibitor.
First of all, we will start with the oral therapy. ठीक है, and then we'll go for the vacuum devices.
Intracavernosal injections.
Vacuum devices. Then we'll go for the muse, and then we'll go for the intracavernosal injection. If all these fail, then what we'll do? We'll put the implant on it. Okay.
Penile process.
समझ गए? कोई रिवाइज करे, आज इसको दो माइक दो भाई, जल्दी से बताओ कहाँ स्टेप लैडर पैटर्न ऑफ ट्रीटमेंट ऑफ इरेक्टाइल डिस्फंक्शन. सबसे पहले ओरल डिवाइस, जैसा एग्जाम में बताएंगे वैसे बताओ भाई. डरना नहीं है, ये क्लास इसी तरह होनी चाहिए ना.
I would advise the patient for lifestyle.
कुछ गलतियां करो, कुछ भी करो, करें भाई, करें, बोलें. ठीक है, बोलेंगे तो आएगा.
I would advise the patient for lifestyle modification with control of his any comorbidity.
Okay, if lifestyle modification is failed, then
I'd start with oral therapy with phosphodiesterase 5 inhibitors, and then I would go for vacuum devices. Then maybe topical
intraurethral device like muse.
And then intracavernosal injections, and if that fails, then penile implant.
Okay, chalo move karo.
As we discussed the treatment options, like identify the curable cause of erectile dysfunction, control the underlying conditions such as diabetes mellitus, hypertension, obstructive urinary symptoms, hypercholesterolemia, and evaluation of antidepressant and antihypertensive treatment. Lifestyle changes include regular exercise, weight loss, reduce or limit the alcohol can also reduce the risk of erectile dysfunction or decrease the erectile dysfunction. Patient with evidence of psychological therapy, referral to the psychologist or sex
तो
therapist is
लाइफस्टाइल
important.
मॉडिफिकेशन एक दफा कोई दोहरा दे, दानियाल तुम कुछ बता सकते हो? हाँ चलो, क्या क्या करते हैं भाई, कुछ तो बता दो। स्मोकिंग बंद करवाते हैं,
smoking and control diabetes, control hypertension, and avoid stressful environment.
और ऐड करो फास्ट जल्दी से, जल्दी से ऐड करो।
Sir, we offer legal exercise.
नजम को सब आता है, आ जाओ आ जाओ, आगे आगे आ जाओ, आ जाओ, कुछ नहीं होता भाई, आ जाओ। जब तक गलतियां नहीं करेंगे ना, जब तक इस तरह बोलेंगे नहीं, उस वक्त तक हमें भी नहीं आएगा किसी को। हाँ
We for keep an exercise and avoid failure, pressure, sitting.
अवॉइड प्रोलॉन्ग साइकिलिंग, अवॉइड प्रोलॉन्ग बाइक राइडिंग। सही है, रखो रखो अपने, चलो आगे चलो।
Patient with evidence of psychological issues, referral to the psychologist or sex therapist is mandatory because it is a curable cause. Drugs for erectile dysfunction can be oral, intracavernosal, and intraurethral. The oral include phosphodiesterase 5 inhibitor, phentolamine and apomorphine, and yohimbine. Intracavernosal drugs include prostaglandin E1L prostadil, papaverine, and intraurethral include L-prostadil. The 4 selective phosphodiesterase 5 inhibitor currently approved for clinical use in the United States have become the preferred first-line therapy for the erectile dysfunction for most of the men because of its efficacy, safety, and ease of use. The 4 phosphodiesterase 5 inhibitor includes sildenafil, that is market name is Viagra, vardenafil, Levitra, tadalafil, market name is Cialis, and efinafil with the name of Stendra. Mechanism of action. Sexual stimulation result in the release of nitric oxide from the peripheral nerve endings and the endothelial cells. Then the nitric oxide diffuse into the smooth muscles of this nitric oxide diffuse in the smooth muscles of vessels and the smooth muscles of corpusculus cavernosa, and this activate the gonalide cyclase. This gonalide cyclase convert the CTP to the CGMP, and the CGMP decrease the calcium channel. In turn, there is relaxation of smooth muscles and the penile erection. The phosphodiesterase 5 inhibitor competitively inhibit the phosphodiesterase 5 enzyme and amplify the nitric oxide gonalide cyclase pathway.
ठीक है, कोई एक रिपीट कर दे तो कुछ समझ आया तो। नादिया आप कुछ बता दें। लिखा हुआ है।
Converted into gonadotrophic cyclase, which in turn convert the GTP into cyclic GMP, which in turn
Increase
the cyclic GMP
calcium content
of the channels and lead to penile erection.
relaxation of the channel, and then there is a increase in the size of the corpus. ठीक है, चाहिए, समझ आ गया भाई? ठीक है, चले आगे।
The comparison of the phosphodiesterase 5 inhibitor, the oral dose of tadalafil is maximum is 20 mg, vardenafil 20 mg, sildenafil is 100 mg, and evenafil is 200 mg.
In
median-
Pakistan, only sildenafil and tadalafil is available. We usually use the first sildenafil, but we are using the tadalafil. The efficacy of the tadalafil is very good, so that's why we are using now. But it is expensive if the patient is not with much community, then we have to use the Vinegra or sildenafil, and if it is from affluent community, then we have to use the tadalafil, because the efficacy of tadalafil is very good, and the results of tadalafil is more than the sildenafil, because the duration of the action of tadalafil is up to 36 hours. So its duration of action is very good. Also, its onset of action is at 60 minutes after taking the medication. सही है? चलें.
What I have, my knowledge, these drugs were not FDA approved. Now they are
Now, tadalafil and sildenafil is approved, but rest of all are not approved right now.
Since sildenafil is expensive, so why do we need 36 hours of So वो 36 hours तक ये effective होता है, then if it's expensive 36 hours हमें क्यों चाहिए सर?
ये
कुछ बताना चाहते हैं?
पूछ रहा हूँ सर.
हाँ, बताना चाहते हैं। और इरफान भाई कुछ बताना चाहते हैं?
एक्सपीरियंस आदमी है बहुत.
नहीं experience नहीं. It's about the half life. The half life is basically about the use of the drug. What happens is, if you are going to take Viagra and you're planning for intercourse, you have to do the intercourse within the 3 to 4 hours after taking the Viagra. Else, the efficacy of the Viagra is not good. With Tadalafil, the thing is, you can take it in the day. You don't have to plan it in the next 3 or 4 hours. And the intercourse can take place in the next 12 hours without any pressure. So it relieves the psychological pressure of the patient too. So that's one of the advantages of the long half-life.
The other advantage of Cialis is that the Cialis is considered as a drug of weekend. When we go for the leave from Friday, Saturday, and Sunday, you can take Cialis and work in the weekend for 2 days.
जलाल कुछ कहना चाह रहे हैं?
Just want to know that whenever you take sildenafil or tenofovir, its effect starts from taking the medication, or no, it is connected with the sexual desire or libido.
No, it needs the sexual stimulation as well. So if there is no sexual stimulation, then there is no release of the nitric oxide and there is no erection. So it needs sexual stimulation as well. Okay. So whenever there is a sexual stimulation, then there is erection and there is a release of the nitric oxide, and then there is a intercourse possible. Okay.
Adverse effects include flushing and visual side effects were more common in patients receiving sildenafil or vardenafil, and back pain and myalgia were more common with the tadalafil. But these events were mostly mild and abated with time.
One is the rarest complication of PDF5 inhibitors is क्या है भाई, और बहुत ही dangerous है. What is NAION? इतना सांप क्यों सूंघ जाता है कुछ? It is a ischemic optic neuropathy, basically, and usually there is a when there is a taking of these medication, there may be a damage to the optic nerve. It is a very rarest, only less than 1%. Some बहुत ही ज़्यादा rare है. So there is a ischemic neuropathy, and there may be it may lead to the field defect in eyes, or it may lead to the blindness as well. So we have to, if the patient comes with these symptoms after PDEF inhibitors, then we have to refer this patient emergency to the neurologist or optician or ophthalmologist. Okay. यूजुअली हमने तो देखा नहीं है, लेकिन ये बुक्स में लिखा हुआ है कि ये भी होता है. रेयरेस्ट साइड इफेक्ट्स है, लेकिन ये होता है. NAION. ठीक है. नॉन आर्टरीटिक इस्कीमिक ऑप्टिक polyneuropathy. Okay.
Phosphodiesterase 5 inhibitor safety issue. There is a sildenafil, tadalafil, and vardenafil, but there is no increase in the myocardial infarction rate. It is contraindicated in patients suffer from the myocardial infarction, stroke, life-threatening arrhythmia within last 6 months.
तो आपने हिस्ट्री में ये एक्सक्लूड करना है इन पेशेंट के कि आपको कोई MI तो नहीं हुआ, आपको कोई CVA तो नहीं हुआ, और या फिर एरिथमियास तो नहीं हुए लाइफ थ्रेटनिंग के आपको एडमिट होना पड़ा. तो ये 3 चीजें आपने एक्सक्लूड करनी है हिस्ट्री में. और अगर आपको कुछ लगता है तो आप फर्स्ट देयर शुड बी अ कार्डियक रिव्यू बाय कार्डियोलॉजिस्ट, एंड देन यू विल प्रिस्क्राइब दिस मेडिकेशन.
If there is a history of resting hypotension less than 90 by 50 millimeter Hg or hypertension 170 by 100, unstable angina, if patients are taking the nitrates, because nitrates result in cGMP accumulation and unpredictable fall in the blood pressure and symptoms of hypotension. Co-administration with other antihypertensive agents considered safe. Interaction with alpha blocker cause orthostatic hypotension, so use cautiously with the alpha blockers. Phosphodiesterase 5 inhibitor contraindications include recent cardiovascular events, nitrates, hypotension, anatomical deformity like angulation, cavernous fibrosis, or Peyronie's disease, predisposition to prolonged erection, sickle cell anemia, multiple myeloma, and leukemia. Centrally acting oral drugs. Apomorphine, centrally acting drug that improve the erectile dysfunction by enhancing the central natural erectile signal. Non-selective dopamine receptor agonist and act mainly on the dopamine D2-like receptor in the brain. Yohimbine, centrally acting alpha-2 adrenergic antagonist, but these drugs are not FDA approved. Intracavernosal injections. Intracavernosal injection of vasoactive drug is considered most effective non-surgical therapy for erectile dysfunction. It remained first-line therapy for selected patient and a valuable treatment option for phosphodiesterase 5 inhibitor non-responder.
This is second line treatment. First line is oral, then second line is intracavernosal injections and Muse intraurethral devices and vacuum erection devices. These are second line therapy. Ji.
Sir, when we are advising this first line drug, so when to declare the patient that he is showing failure and then should to switch into the second line? How much trial should be given?
Yes. So we have to give 8 times. If the after 8 times there is no effect, then we will label this patient as failure of this oral medications.
The question is very interesting. One of the principles of giving oral drugs for erectile dysfunction is if there is drug failure, the first thing that we need to do is we need to assess if the patient is taking the drug rightly. That means that, for example, if the patient is taking sildenafil, is the patient having food with sildenafil? Does the patient have any desire during the process, or is he expecting the drug to work on itself? And if the patient is doing the required act during the specific half-life of the drug, or is he exceeding the half-life? If all of these criteria are then met, then we can counsel him further.
Dr. Irfan is very right. Before starting of oral therapy, we have to send this patient to psychosexual therapy. So psychosexual therapist will tell all the things, whatever Dr. Irfan said, that these drugs should be taken in same quantity and erection should be done at time, and within period of action of these drugs, they have to do the intercourse. So these patients are counseled first, and then we will prescribe this medication. And if after counseling and after taking proper dose of drug, if the 8-time failure is there, then it will be labeled as a failure of the oral therapy. And it is the statement of Dr. Asif Munir, which is a very leading reproductive surgeon and urologist at King's College London. Okay.
So, which patients are eligible for this first-line drugs? Like, if the patient is complaining after this post-TRPR diabetic, and
no, we have to correct. First, we have to do the lifestyle modification. हमने पहले discuss कर लिया. कोई एक जल्दी से बता दे lifestyle modification क्या था? Lifestyle modification हमने क्या बताया था? जल्दी से कोई बता दे भाई. अब तो सबको याद हो जाएगा. हाँ. एग्जाम वाले तरीके से बताओ.
Sir, we have to stop the patient smoking, stop alcohol intake, and patient diabetes should be controlled, hyperlipidemia should be controlled, and avoid stressful exercises, avoid prolonged sitting.
And we should prescribe him to Kegel exercises. Dr. Irfan is saying something.
So once again, just a small thing. Erectile dysfunction is to be treated as a symptom and not as a disease. So the first thing is, whenever a patient comes to you with erectile dysfunction, it should be counseled that ED is usually a symptom of a broad disease and that he should get worked up for the heart, for any coronavascular or any other disease first, and then we proceed further on.
Yes, we have to counsel both patient and as well as his partner, and the counseling is very important. First, we have to go for lifestyle modification, psychiatric evaluation, and then psychosexual therapy, and then we'll start this medication. क्या किसने क्वेश्चन किया था? क्या तुम्हारे क्वेश्चन का आंसर मिल गया? ठीक है, चलो चलो ये क्या है?
This is a video of how to inject intracavernosal injection.
There is a question that how smoking affects erectile dysfunction.
It may lead to the atherosclerosis of the arteries, like internal pudendal artery, and there may be a decreased flow to the cavernosal bodies, and it will cause the erectile dysfunction. It's basically a arteriogenic problem to the smoking. इरफान भी कुछ कहना चाह रहे हैं, ठीक है, ओके आगे. You got it भाई, आवाज आ रही है?
Yes sir, thank you.
Okay.
So intracavernosal injection is very safe and highly effective. We will discuss the most commonly used agents. The most commonly used agents include the L-prostadil. The market name is Caverject. L-prostadil is actually prostaglandin E1 that increase the cyclic AMP, vasodilate and relax the muscle of the corpus cavernosum and penile erection. The success rate of L-prostadil is 70 to 75%. Second most common agent is papaverine. It inhibits the phosphodiesterase in a smooth muscle cell and increase the cyclic AMP and cyclic GMP. In turn, relaxation of the vascular smooth muscles of the corpora and the smooth muscle of the corpora cavernosa. Phentolamine block the adrenergic receptor in penile blood vessels, relaxation of trabecular cavernous smooth muscles, and dilatation of penile arteries. Its effect is weak when used alone, so it potentiates the effect of L-prostadil and phentolamine, and we use with the combination therapy. The most commonly used drug combination are bimix that include papaverine and phentolamine, and trimix that include papaverine, phentolamine, and L-prostadil.
Okay.
Priapism and fibrosis are the most common and most serious side effect of the intracavernosal injection. Fibrosis can be prevented by applying the pressure greater than 5 minutes on the injection site. It reduces the hematoma and reduce the fibrosis. While the priapism can be prevented by reducing, adjusting the titrating dose.
तो भाई कैसे प्रिवेंट करेंगे ये हेमेटोमा, फाइब्रोसिस और ये सारी चीजें? आपके पास वीडियो है लगाने की?
इसकी वीडियो,
इसको लगाने की वीडियो है?
नहीं.
अच्छा चलो ठीक है. तो कैसे प्रिवेंट करेंगे ये सब हेमेटोमा, फाइब्रोसिस? फर्स्ट ऑफ ऑल वी हैव टू टीच द पेशेंट दैट हाउ टू इंजेक्ट द ICI into the corpora. Okay, so and then if this drug is injected, then we have to put the pressure for 5 to 10 minutes to decrease the hematoma formation. And we teach the patient that you have to change the site regularly, so it will decrease the chances of fibrosis. आप यहाँ से जैसे this is penis, then you can apply first here, then there, then there, then there, then there, then there. So it will decrease the fibrosis. It will decrease the chances of hematoma formation. So that's how we'll teach the patient. And patients are very good. We have 2 or 3 patients. We taught that patient that how to inject the ICI. Then they are very compliant and they are very pleased. Okay.
Sir, I have a video.
जी.
After how much time will inserting the injection patient should undergo?
Usually we say to the patient that wait for 10 to 20 minutes so to have a good action of the drug, and then he can go for intercourse. Okay. And there may be a bleeding will be stopped after 9 minutes, and then we'll go for it. Okay.
Here's a short video to how to inject the intracavernosal injection.
Out from the body by grasping the head. Pull the skin back before doing this on an uncircumcised penis. Sterilize the injection area on the penis with an alcohol swab. This should be near the middle of the shaft, near the 1030 or 130 area. If there is discomfort or resistance, you need to choose a new insertion spot. It's best to inject on the opposite each time to avoid irritation in the injection site. Hold the needle like a pen and press the tip into the injection site on the penis. Do not touch the plunger until the needle is inserted. This avoids leakage of any of the dosages. Press the remainder of the needle into the penis and press the plunger until all the medicine has been injected into the penis. Slowly pull the needle straight out and set it aside. Apply pressure to the injection site with a sanitized pad for 3 minutes. This prevents scarring. Anyone taking a blood thinning medication will need to apply pressure for 5 minutes. Discard the needle in a sharps container. It will take a few minutes for the medicine to take effect.
So we usually apply phentolamine. Sometimes we apply the piperine. Piperine very cheap. So we have seen the very good result of piperine. Also, trimix and bimix is very good. What is the dose of trimix and bimix? किसी को आती है? Dose कितनी होती है?
ये फिर वो चाहिए होगा मुझे
ट्राइमिक्स के लिए जो है वो 0.5 ml है और बायोमिक्स के लिए 0.4, बल्कि ट्राइमिक्स के लिए जो है 0.4 ml है और बायोमिक्स के लिए 0.5 ml है। ये ट्राइमिक्स इज अ कॉम्बिनेशन ऑफ एल्प्रोस्टाडिल, फेंटोलामीन एंड पिपरवीन। ठीक है, तो ये ट्राइमिक्स बहुत ज्यादा इफेक्टिव होती है। जी जी, नहीं यूनिलेटरल, एक साइड। हाँ हाँ बिल्कुल, क्योंकि कैवर्नस कैवर्नस कॉर्पस कैवर्नस आपस में जो है वो कनेक्टेड होते हैं, तो इस वजह से जो है वो। जी,
This L-prostadil dosage, piperine dosage is 20 to 80 milligram, phentolamine 0.5, bimix dosage is 30 milligram per ml plus 0.5 milligram per ml phentolamine. Trimix include piperine 30 milligram per ml plus phentolamine 1 milligram per ml and then L-prostadil 10 microgram per ml.
टोटल 0.4 ml बनती है।
0.4
अच्छा, फिर
Invicorp vasoactive intestinal peptide plus phentolamine 25 microgram VIP and phentolamine 1 to 2 milligram. The highest efficacy is for the trimix.
Sir, can we give piperine or phentolamine as alone therapy, monotherapy?
Yes, we have seen a very good result of piperine. You can use piperine for a monotherapy.
But
But there is satisfaction, and satisfaction rate is very low to the trimix if we compare these drugs to the trimix. But it will works. It will work. We usually give piperine because our patients are not so affluent, so and they are poor, so that's why we use the piperine, and piperine effect is very good. We have seen in our OPD.
Yes, sir. Thank you.
Intraurethral drug include L-prostadil Muse. Dosage is 125 mg, 250 mg, 500 mg, and 1 gram. Alternative treatment for intracavernosal injection who prefer less invasive. In this, the palate inserted with the applicator and massage penis to aid the absorption. Vacuum constrictive device is a treatment of choice in well-informed older patient with infrequent sexual intercourse and comorbidity requiring non-invasive drug-free management of their erectile dysfunction. Satisfactory is as high as 90% for patient without bleeding disorder or anticoagulant therapy. Blood trapped in the intracorporeal and extracorporeal compartment of penis, constructing ring at the base of the penis, and maximum time is 30 minutes. This is a video that explains how to apply the vacuum constriction devices.
So still this is the second line therapy. Okay, the second line therapy include the ICI, intracavernosal injection, vacuum devices, and intraurethral Muse, L-prostadil or prostaglandin E.
Step 1. Loading the tension system. Place the loading cone into the bottom of the cylinder and place it on a flat surface such as a table or countertop. Lubricate the loading cone. Grasp the bulky part of the handles of the tension system and slide it down onto the cylinder, mounting it approximately 1/4 inch from the edge of the cylinder. Remove the loading cone. Insert the large comfort insert into the base of the cylinder. If necessary, insert the small comfort insert into the large comfort insert. Step 2. Assemble your system. Assemble your system by lining up the negative pressure device with the negative pressure cylinder. Give the negative pressure device a 1/4 inch turn to secure to the negative pressure cylinder. Do not over-tighten. Step 3. The lubrication process. Lubricate the inside of the bottom of the cylinder generously up to 2 inches inside the cylinder. Lubricate the glands of the penis to ensure that during engorgement the penis will not stick to the sides of the cylinder. As if applying toothpaste, lubricate the rim of the cylinder and comfort insert with a generous bead of lubricant. Step 4. The application process. Apply the system over the penis with the system pointed down towards the floor at a 45-degree angle. Make sure that the penis is resting at the bottom of the cylinder. Give the system a twist back and forth to ensure that a good seal is created against the body. Do not press the cylinder too hard against the body. Begin operating the negative pressure device by pumping the handle 3 times. Wait 10 seconds to allow blood to flow into the penis. Continue this start and stop process until the penis has reached full engorgement and the penis has lifted from the bottom of the cylinder. Be careful not to create negative pressure too quickly or overpump. Step 5. Tension system transfer. Holding your hand as if making a C, push the tension system from the cylinder onto the base of the penis. To ensure correct application, please complete this step in one smooth motion, being careful to pull your scrotal tissue downward before transferring the tension system. Step 6. Removing the cylinder. To remove the cylinder, press the round black pressure release button. Once the pressure is released, remove the cylinder from the penis. Once you have removed the cylinder, you are now ready to begin sexual intercourse. Step 7. Terminate the erection. Grasp the tabs and pull evenly on both sides. Allow 10 seconds for blood to flow from the penis. Once the penis has become more flaccid, pull the tension system away from the body and off of the penis.
So this will create the vacuum around the penis, and which will increase the blood flow of cavernosal bodies, and then we put the applicator or constrictor at the base of the penis, and then we can a patient can do the intercourse for 30 minutes, and we can use the vacuum devices with oral therapy as well. We can combine the vacuum erection devices with oral therapy phosphodiesterase inhibitors to increase the efficacy of both treatment. Okay.
Adverse effect of vacuum constricted devices include pain, inability to ejaculate, bruising, patchy, numbness, and the serious adverse effect skin necrosis can be avoided if patient remove the constriction ring within 30 minutes. Penile prosthesis. The surgical implantation of penile prosthesis may be considered in patients who are not suitable for different pharmacotherapy or prefer a definitive therapy and do not respond to other treatment modalities. The 2 currently available classes of penile implant include inflatable and semi-rigid. Inflatable are 2 types. Inflatable devices are of 2 types, 2 pieces and 3 pieces. And semi-rigid devices are of 3 types: mechanical, malleable, and soft flexible. There are two surgical approaches to insert the penile prosthesis.
Advantages of this semi-rigid device. Semi-rigid device are we usually use not LNH and other center uses the malleable devices. Malleable devices are quite common in Pakistan. So what are the advantages? ये बताएंगे भाई. Exam candidate कौन है? कुछ बता दें. आप बता दें. आप भी एग्जाम कैंडिडेट है नेक्स्ट ईयर के. आसान बातें, कोई मुश्किल नहीं है इसमें, कोई मुश्किल नहीं है. ऐसी आप सुनेंगे ना, आपको लगे ऐसी झापू बातें हैं जो मैं करूंगा. ठीक है
सर. Haven't read about it, but heard from you that we can use RIP.
नहीं अबे भाई देखो मैं, this is the problem. So what I have a question to this guy, and he is what he's asking and what he's answering to my question. So this is a problem in exam. I'm asking about the malleable devices, and he is answering about the RIPs. So this should not happen. If you don't know, then say I don't recall right now. Okay. So basically, the malleable devices or semi-rigid device are cheap. बहुत ही ज्यादा सस्ते हैं. बहुत ज्यादा तो नहीं, अभी पाकिस्तानी करेंसी तो बहुत बढ़ गई है, तो ये 2-2.5 लाख में आ जाते हैं. हाँ, कितना? 70,000. अच्छा. तो वो सर इंडिया तो बहुत ही कॉपी करता है. चाइना ने शायद कोई 50,000 का बना दिया हो, लेकिन जो यूके और यूएसए के जो है डिवाइसेस हैं वो 2 लाख से 5 लाख के आते हैं. तो एक तो चीप है बहुत, और रेडीली अवेलेबल हैं, वो कहीं भी अवेलेबल हो सकते हैं, और इंसर्शन इज वेरी इजी. इंसर्शन इज वेरी इजी. आपके पास डिवाइसेस की वीडियो है वीडियो, तो जल्दी करो भाई. अच्छा, और इसका लेकिन डिसएडवांटेजेस क्या है? एक तो जो है there should be no detumescence. The penis is always in the erect position, so this is not good for the patient, and the feeling of the patient is not good with this. And you cannot, if the penis is erected, that you cannot hide this erection from underwear or anything else. And the other disadvantage of the malleable device is there is no such satisfaction to the patient like AMS and inflatable devices. So satisfaction is not good as compared to inflatable devices. तो दो चीजें हैं, एक तो हमेशा इरेक्शन में रहता है और पेशेंट की satisfaction is not good, और फिर इसकी complications भी होती हैं, वो हम डिस्कस कर रहे हैं. चलें. Yes, and the satisfaction of the patient is obviously not good. So that's why, because there is no normal like rigid direction in these devices. In malleable में नहीं होती. ठीक है? हाँ, inflatable में होती हैं, बिल्कुल होती हैं. जी.
This is the video for the malleable device in which manually the
so malleable devices is only consist of 2 cylinders, nothing else. No reservoir, no pump. Okay, chalo. So these are the devices in the torpeda, and you can manually bend the pin. But during bending, it is on erected position. So that's why the patient's satisfaction is not good. Okay. Does this affect the patient's pleasure को? लेकिन उसकी तरह नॉर्मल, हमें तो जो है वो सेटिस्फेक्शन नॉर्मल की तरह ले आनी है ना पेशेंट की, तो वो सेटिस्फेक्शन नहीं होती. लेकिन गरीबों के मुल्क में कुछ भी मिल जाए तो चलो.
This is the video for AMS 700, that is inflatable devices.
This is 3-piece.
3-piece inflatable
AMS
device.
is 3-piece.
Experience erections for as long as you'd like and do it all with spontaneity. With the AMS 700, a permanent, discreetly implanted device designed to help you regain control,
This pump,
you can.
this reservoir.
The AMS 700 is designed to closely mimic a natural erection. It provides rigidity when inflated, typically does not interfere with ejaculation or orgasm, and has a natural flaccid appearance when deflated. It has 3 parts: a cylinder, a reservoir, and a pump. When you're ready for intimacy, simply squeeze and release the pump. And when you're done, just press the deflate button once. The AMS 700 is the #1 physician-preferred penile implant. 97% of people who get an AMS 700 implant feel satisfied with their sex life. And it's the only penile implant that maximizes your potential length, girth, and rigidity. You can even get it if you have health conditions like prostate cancer, diabetes, or cardiovascular disease. And there's a good chance your insurance will cover it. Most penile implant procedures are covered by insurance or Medicare. If you don't have coverage, ask about financial support available through partnerships between Boston Scientific and lenders. Take the next step. Find a doctor at edcure.org.
So what is the disadvantage? Its advantage is it's make the penis like a normal erection, and there's a good rigid erection. But the disadvantages are, पहला वाला cheap था, ये क्या होगा? Expensive. It is very expensive. It costs around, I think, to 20 lakhs. 15 to 20 lakhs. क्योंकि पाकिस्तानी रुपया डिवैल्यू हो गया, हम गरीब हो गए, तो अब जो है वो, तो ये 20 लाख, पहले 8 लाख का, 8-9 लाख का आ जाता था, 20-25 लाख का आता है. ठीक है. और there may be a risk of infection more. There may be a risk of mechanical failure. मैकेनिकल फेलियर इसमें होता है क्योंकि आपके पास मैकेनिज्म है, तो इसलिए जो है ये मैकेनिकल फेलियर हो सकता है, इन्फेक्शन हो सकता है, और जो है ये बहुत ही ज्यादा एक्सपेंसिव है.
रिजर्वायर का क्या?
Other is sir, there is no glands engorgement in these implant, so there is major dissatisfaction of the patient with glands engorgement.
सही. आप क्या कह रहे थे?
रिजर्वायर क्या?
Reservoir will like bladder. जिस तरह ब्लैडर है ना, वो पानी को जो है वो, तो हमने 100 ml नॉर्मल लाइन डालना होता है, वो रेजरवायर में रहता है, वो पंप पे नहीं रहता. ठीक है. तो वो आप जैसे ही जब आप प्रेस करते हैं पंप को, when you are pressing the pump, then the reservoir will the water in the reservoir, means normal line in the reservoir, will lead to the directly cylinder, and then if you press again and compress the penis, then it will go again into the reservoir, not in the pump and the tubings. Okay. लेकिन जो 2 piece होते हैं उसमें फिर पंप और ट्यूबिंग में ही रहता है पानी. ठीक है. लेकिन उसमें भी जो है वो डीटर्मिसेंस होती है. तो 2 पीस क्यों बनाने का ख्याल आया लोगों को? कुछ तो होगा भाई, टाइम वैसे हो गया है. पेल्विक सर्जरीज अगर किसी में हुई हो तो हम जो है रेजरवायर डालना बहुत मुश्किल होता है, या फिर जो है किसी की एंटीरियर रिसेक्शन हो गई, आपने पढ़ा होगा एंटीरियर जो रेक्टल कार्सिनोमा में करते हैं, या फिर लोअर एब्डोमिनल लेप्रोटमी हुई की, तो उसमें जो है वो रेजरवायर वी शुड प्लेस इनटू द रेड्सियस स्पेस. व्हाट इज रेड्सियस स्पेस? इट इज द स्पेस बिटवीन द, क्या है भाई सिस्टोलिथोटमी के माहिर, बिटवीन द ब्लैडर एंड द प्यूबिक बोन. ठीक है. तो रेड्सियस स्पेस में हम रखते हैं रेजरवायर. तो रेजरवायर प्लेसमेंट इज वेरी डिफिकल्ट इन लेप्रोटमी पेशेंट्स and if the patient had undergone the anterior resection. So that's why we place that, in that patient we place the 2 piece. 3 piece नहीं press करते. ठीक. चलो.
These are the recommendation for the treatment of erectile dysfunction of EAU guidelines to 2023. Assist all patients for incorrect information about the mechanism of action and the way in which drugs should be taken, as they are the main causes of lack of response to phosphodiesterase type 5 inhibitor. Use cognitive behavior therapy as a psychological approach. Include the partner combined with medical treatment to maximize the treatment outcome.
Psychosocial therapy हो गई. आगे.
Initiate lifestyle changes and risk factor modification prior to or at the same time as initiating erectile dysfunction treatment. Treat a curable cause of erectile dysfunction first when found.
ये वीक इसलिए लिखा हुआ है कि मैंने भी ऐसा कोई कॉज नहीं देखा यूजुअली कि जो अपनी पूरी प्रैक्टिस में, लेकिन होता होगा. ठीक है. हाइकोजेनिक है, हार्मोनल है, एनाटॉमिकल है, ये तीनों होते हैं, लेकिन मैंने ऐसे पेशेंट नहीं देखे यूजुअली. जी.
Use phosphodiesterase 5 inhibitor as first line therapeutic option. Use topical intraurethral alprostadil as an alternative first-line therapy in well-informed patients who do not wish or who are not suitable for oral vasoactive therapy. Use topical intraurethral alprostadil as an alternative first-line therapy in well-informed patients who do not wish to have intracavernous injection or in patients who prefer a less invasive therapy. Use intracavernous injection as an alternative first-line therapy in well-informed patient or as second-line therapy. Use vacuum erection devices as an alternative first-line therapy in well-informed patient with infrequent sexual intercourse and in patient with comorbidities requiring non-invasive drug-free management of erectile dysfunction. Do not use platelet-rich plasma to treat erectile dysfunction outside the confine of a clinical trial. Use implantation of penile prosthesis if other treatment fail or depending upon the patient's preference. Discuss with patient undergoing radical prostatectomy any technique about the risk of sexual changes other than erectile dysfunction, including libido reduction, change in orgasm and ejaculation, Peyronie's-like disease, and penile size change. Start pro-erectile treatments at the earliest opportunity after radical prostatectomy, pelvic surgery, and other curative treatment for prostate cancer. Data is inadequate to support the use of any specific regime for penile rehabilitation after radical prostatectomy.
Thank you very much. Very good presentation.